Hey, Dr. Eric Herman, the Guru Chiropractor. Big Tom over here, coming all the way up from Delaware, right? Almost a couple hour drive. Team Ring Dinger Doctor of Central New Jersey. He's about to get his first ring dinger. Yes. You excited?
Absolutely.
You found me same way most people find me. You had chronic back problems, yes. So you're doing searches. You're trying to figure out the best thing for you, and you came across ring dinger, I guess, on social media. Dr. Johnson, you found his videos first.
Dr. Johnson,
the master, and then he got interested, did some research, said that really feels, seems like it's something you want to try, could be helpful, and then you look for a local guy,
right?
And I'm the closest guy that's certified, and here you are. Yes, took the ride up.
Here I am.
So I appreciate you taking the ride. We already did the intake. It's safe to treat. We did a good solid. By the way, you're okay if I say what you do for a living, right?
I'm fine with
Nurse for how long? 15, 18 years, you said?
Years.
So did I do a good health history interview? Super. Am I on point with that stuff? Because I really work hard to do the right thing for safety and to get the right information so I can make a proper diagnosis, be safe, and help my patients out. Absolutely. So we did a good solid health history interview. It's safe to treat. Did a good solid examination. I feel confident that the ring dinger is going to help him with his, oh, by the way, lower back. I didn't say what his problem was. Chronic lower back problems.
I got full faith in the ring dinger.
It's been going on for about a couple years. Heard it in the gym, you think, right?
Yeah.
Initially, like early 23, yep. And you had a little stint of a pretty nasty sciatica down the right leg.
Yeah.
But that kind of cleared up.
Yeah.
But the low back pain stayed persistent.
Absolutely.
Okay? It's not severe. No. It's kind of mild to moderate, right. Pain-wise.
Pain-wise, yeah.
So it's not taking you out of the game. It's not benching you.
No.
But it's annoying. And it's not going away. It's not fully resolved.
Exactly.
I get it. Discomfort's pretty constant. You told me when we were talking it was a 1 or 2, so it's not that bad. It averages around 3 or 4.
Right.
Gets worse when you run, when you jump, when you're pounding on it kind of thing. And it's really stiff when you get up in the morning after you sit or lay for a long time, which is a common pattern, by the way. A lot of patients report that have chronic back problems. When they move around a little bit, warm up a little bit, it kind of eases up. Yeah. But when they stop and get sedentary or stationary, things start locking down. Yeah. And get up in the morning, you're stiff. You're like, oh, right. Takes a little while to warm that up and get it going again.
That's exactly
is that it, right? Yeah, it's a very common pattern. Well, we're going to do our best with the ring dinger. And if you're like a high percentage of people, hopefully it's going to interrupt that pattern, yes. And get you out of that chronic mode, and hopefully get some resolution, or at least a lot better relief and a lot less pain.
Yeah, that's my plan. I have full faith in the ring dinger.
I love it.
Yes.
Statistically, patients, they've done studies. They've done sociological studies. Patients who have high faith in the procedure and or the doctor do better statistically than patients who about the procedure. So that helps too.
Yes,
that helps too.
Absolutely.
All right. Anything else you want to say? Did I cover it all pretty good as far as what's going on? And
I think you did. Dr. Herman's pretty solid.
Yeah.
Pretty solid.
Thank you. All right. So let's get it going. First thing we're going to do that I do with all my patients is we're going to loosen you up with a little massage first, just to kind of warm up, get some blood flow going, relax you a little bit. So face back down there. And we have Nala here again. Nala's in her little luxury condo. Hopefully she won't bark too much while we're trying to get some work done. Yeah. Definitely got a lot of stiffness in your tailbone, L5, S1. By the way, you told me too, initially you got some x-rays and some MRI, and there's definitely a herniation down there, L5, S1, right? Yeah. But amen that it hasn't been banging on that nerve lately, so because you haven't had any radiating pain, so thank God for that, because that stuff's nasty. Yeah. But it's really locked up here, compressed, and that's why it's not resolving. The body can't resolve it. It can't unlock it, and nothing you've done so far, obviously, has really unlocked that compression, and that's why it persists. So hopefully today will be an interruption in that pattern. All right, let's get the thumper going. We'll loosen you up a little bit first. Right, Nala? Anything I'm doing doesn't feel right, let me know right away. I think it's time to get a new thumper though, because it's not supposed to make this rattling noise. Or is that you rattling, or is that my massager? Just messing around. That's not the patient, that's the machine. Ouch, I see it twitching a little bit. Sensitive. Yeah. A lot of times, people think it's, you know, it's ticklish, but it's really hypersensitivity from being irritated, from being chronically irritated, and the nerve is firing. This side not as bad? Yeah. Well, this was the side that the sciatica was on, right? So that makes sense. That makes sense. Good. Let's get a little tension up top. You said you had some chronic tension from sitting long periods of time. Good. Good. Also, you have, when we did the exam, you have a 2 1/4 inch forward head posture. So we're going to check that afterwards. We'll check it on camera and see if that made a difference after we do some work. So, all right, done with the massage. Come on up slow from here. Take your time, no rush. And we're going in the back room. Face up, head here. So lay on your back, put you, yeah, right about that way. Keep your hands up on your chest for me. Now I got to feel the top of your hips, your iliac crest, because we got to get you lined up specifically on this table so that the pins go in. You're about 2 inches too high, 3 inches. So slide down a couple inches. Perfect. All right, you just work on getting yourself comfortable and relaxed. I got to set up the table. I'm going to raise it up. Then we're going to lift the knees up, and what that does is it flattens out your lower back curve, your lordosis. I haven't said this on camera in a while, but I'm going to say it for the people who might watch the video. Normally, there's 3 curves in the spine. The neck and the lower back curve like this. It's called the lordosis. And the middle back curves opposite. It's called the kyphosis. So when your normal position, you have a curve, your lumbar spine is curving up and the vertebrae are like stacking around the rainbow, right? Mm-hmm. So if I try to pull when it's like that, it's going to be a lot harder to decompress them. Mm-hmm. When the knees come up, it rotates the pelvis and it flattens out that lumbar spine. So now the vertebrae stack like dominoes. So when I do pull, it's much easier, plus it relaxes the spine, but it's much easier to decompress the disc when they're stacked like dominoes than when they're up around the rainbow. Make sense? Yes, makes sense out there? Okay. I'm just doing a little education for you. And, well, you probably know already from nursing, but for the people who might be watching, coming up. Plus, this position over the years, I have recommended for people with chronic back pain, gives relief sometimes. I sometimes recommend that they sleep like that. If they get relief, they got to test it first.
Mm-hmm. I actually lay on my living room floor like this all the time.
Yep, legs up. It does give relief to a lot of people. Now we got to pin you in real tight here, because when I pull at the neck, I don't want your body to slide. Because if we slide, we lose some of that force going down here. But if you stop short, that force goes bing, and gets the lumbar spine just about every time. That's why, by the way, Dr. Johnson named it the ring dinger. Did you ever go to the fair or the carnival where you hit the bottom of the pole and you try to ring the bell at the top?
Yeah.
So when he's here about to pull, he visualizes ringing that bell, which is all getting the force all the way down to the lumbar and getting it released. Because people make fun of the ring dinger name until they know why he named it that. Then it's got some meaning. Can you handle that, or is that too tight? Good. Because if it's good and tight, we're going to get a good release. All right. Now, give me your hands back to me. This is not the treatment. I'm just making sure you're pinned evenly and there's no slack. Yeah, you're good. All right. Rest them back here again. Here. Yeah. Now, the towel is just basically because my hands are too small to get a good enough grip on your skull. So the towel gives me better grip and better leverage. Lift up your neck and drop it. Good. So most importantly for you for safety is keep your teeth closed. Mm-hmm. Don't bite too hard with your jaw because then it makes your neck too tight. Just keep them naturally touching. Mm-hmm. And then do your best to keep the rest of your body as loose and released and heavy and floppy as you can. Okay? Mm-hmm. You ready to go? Mm-hmm. All right, here's what we're going to do. I'm just getting a good grip on the towel first. And then the first thing I'm going to do is just traction out your spine. I'm going to stretch it and take out all the slack and start opening up those discs. As that's happening, I want you to feel it, and do your best just to keep your body relaxed. Feel that stretch, feel it all the way down. Let your body stay relaxed, feel it to the tailbone, let everything go. Good. And boom. I was waiting for you to react. Did you feel it release all the way down?
I felt it crack right at the bottom there.
Perfect. Okay, that's the ring dinger. That's a proper disc decompression. Was that like the itch that you were looking to get scratched that nobody could do for you yet?
Yeah, absolutely. I wasn't expecting you to go at the moment you went, and I'm happy I wasn't prepared for it.
Yeah. Part of the skill set is, because if I pull and you tighten up at the same time, not good. I mean, I don't think it's going to be dangerous, but it's not going to get a good release.
Right.
So I got to be a little sneaky because I got to get that window open where you're not clenching, right. And that's what gets the bigger releases. Now, I'm going to ask you, I'm going to leave it up to you. Mm-hmm. Since you've driven so far, if you want a double pull, we could do a double dinger. It's safe. Do them all the time, almost on a daily, definitely on a weekly basis. Okay. The only thing that you need to consider is you're probably going to be a little sore from this procedure, but you might be a little extra sore with a double, but it's going to give you a bigger release. And I know, to get back here for follow-ups, it's a little bit of a hike. Yeah. So it's up to you. If you don't want to do it, we're going to do more release over on the other table. But if you want another one, I'm down to do it. Huh? No. Oh, Ed, no extra charge.
That's a good question.
Yeah, no extra charge. I'm stupid. I should charge, but I don't. It's no extra charge.
I'm down to do it.
No extra charge. Yeah? All right. Right, you good now? You want to go? Yeah. All right. Let's pin you in. I recommend it, especially for people that can't get back here so easily for follow-ups. So we're going to pin you back in again. He's like, another 350? Mm-hmm. No. Trust me, if it was, I would tell you before I did it. That's bad. Can you handle? Still tight? Okay. Yeah, we're gonna do a good another.
You wouldn't have to pay if you come.
Yeah, I mean, I don't do that. I'm all about integrity, baby.
Right.
Good. All right, same thing. Keep them touching. Keep it relaxed. You ready to go again?
Yes.
Okay. Again, we're gonna stretch you out first. Keep your body loose. Feel your butt cheeks. Let them let go. Feel your thighs. Good. Mm. Another one? More release? All right. Nice. Yeah, whenever I get a ring dinger, which by the way I've got about 30 of these over the last 5 years. I get a double just about every time. Yep. Coming down. Was it painful?
No.
People want to know. That's one of the biggest questions I get from people is, does it hurt?
The first time was a big one. The second time wasn't as big, but it's not painful.
Yeah. For most people, by the way, since we're talking about it, most people say it's not.
Yeah.
If they're acute, though, I remember we were talking about
Right.
if you got a hot disc and you're acutely in pain, yeah, it's gonna hurt because anything hurts. You just touch a person and they scream,
Exactly.
but they get relief really quickly afterwards. All right, stay there, stay. I want to check your neck, possibly do a little more releasing while we have you in this position. Then we're gonna get you on your sit first, make sure you're not dizzy. Then we're gonna get you on your feet, and you're gonna bend around a little bit and see how you feel. Let us know. Relax. Good. Drop it in my hands. Nice. Good. Just a nice little extra release in your neck. All right, we're done here for now. So easy and slow. Sit up first. Sit. Make sure you're not dizzy. Once in a while, it doesn't happen too often, but once in a while, somebody's a little woozy after they do this. So I don't want you to just jump quick on your feet. Sit first. Check in with yourself. If you're not woozy, then you can stand. Okay. Once you stand, stop for a second. Feel your body. Maybe bend and move a little bit. See, test it. See if it feels any different.
I still feel my stiffness, but yeah, it's not as tight.
Okay. So there's still some tightness, but it's reduced.
It's reduced a lot, yeah.
Good. Well, again, I want to make a point. The ring dinger gets the spine, but you also got some jamming in your pelvis. The pelvis we're going to get over there now when we go to that table. So that might be why you're still feeling a little tightness. But that's a good sign that when you get a full spine decompression, that's the most common. Damn it, I'm jealous. You're too damn tall. Walk through a little bit. See how that feels walking. But yeah, people say they feel lighter, longer, more released.
And my neck, I don't feel like my neck is drooping. I feel like usually
because we'll measure it later, but I guarantee you your head's more, yeah, it is. Or I can already see, but we'll measure it at the end. It's definitely more stacked on top of your body.
Right.
So it's not this way, so it's not yanked. Yeah.
I can feel it.
Cool. All right, when you're ready, back down on your belly. And you told me when you first laid on your belly that you felt pulling here. Does it feel the same pull or different?
No, it's definitely far less pulling.
Excellent. That's a good confirmation that we did some good release. Let's feel. Yeah. In general, as I palpate, the tone is much healthier. It's less jammed. It's not as spasmed in here. So you got more mobility in the joint. You got more play in the joints. That's a good sign. All right. Next thing we're going to do for like midpoint check. Remember when we bent the knees the first time, you told me it was pulling here?
Yeah.
Okay. I'm going to rebend the knees. Tell me if it's pulling the same as before, reduced, or gone. Bend. Gone? Woo, I'm clapping feet. I get excited that's good. In fact, that's awesome. Most people say it goes from something to reduced at this stage. Occasionally it goes from something to nothing. That's a very good sign, my friend. No BS. That's good. All right. Now we're going to do more releasing here in the pelvis, and then we're going to work our way up the spine using what's called the drop technique. So slide down about an inch. A little bit, right there. Good. Now I'm going to drop down the belly. There's a trap door, which also is for pregnant women. I'm trained I could treat all the way through pregnancy if there's no complications. Or for big guys with big beer bellies. You don't got one, but also for what I'm doing for you is it gives me more space here to get a deeper release. That's why I'm doing it for you. Not because you have a beer belly. You ain't got no beer belly. So the table pops up, and then I'm going to push down on you, and it's going to go boom. Okay, that's what to expect. Just stay relaxed. Good. Good. Boop, 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 boop. Nice. Good. That was a crunchy one right there. Okay. Also, a little bit more. Good. Also, remember in the beginning I told you you had a left torque, Now it's very neutral here. So we pulled out the whole damn torque. Slide up towards your head a little bit. Uh-oh. Don't hit that button over here. If you hit the eject button, you're in trouble. Just mess around. Pulled the head off, the whole 9 yards. Hold on. Let go. Don't worry. You didn't break nothing. Okay. Let it twisted. Let's see. We'll get rid of that later. Probably edit that out. Technical difficulties. All right. Now, lift up the belly. Now we're going to do some more. Stay relaxed. Stay relaxed. Good. Good. Nice. Good. Ben. Still good up there? Yeah. Nice. Now we're going to do that second test. Remember the stiff leg lift? All right. Start with the left. Lift as high as you can. Look at that, baby. Drop it down. We didn't film the first one on, but
Pain there.
Pain, and you were grunting, and it didn't go up as high. Right. Now let's try the right side. The right side wasn't as bad, but normal now and easy to lift, yeah? Yes. All right, good. So that confirms that now the pelvis is nicely released, and the lumbars have very little compression, so that's doing great. Now we're going to, just because I do a full body, now we're going to work up this way. Let it go. Good. 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 Also, a lot less pressure here in the transition area that was there when we did the initial exam, and that was from the forward head posture. So based on what you said when you got off the table, what I did, took a peek at you when you were standing and feeling this, I would bet big money your forward head posture is significantly reduced. Chin down towards your feet. This is going to help though, right here. Transition. Good. Stay relaxed. Oh, misfire. Hold on. Let it go. Good. Does this feel as sore? Remember I was squeezing up top and we were talking about the sinuses and the headaches? It feels looser to me too. So hopefully that'll help with your allergy symptoms. Good. All right. Roll over on your back. Face up. You're doing good, sir.
Thank you.
Slide down about an inch. Right there. Good. Now, we're going to work on the front a little bit. We're going to release the collarbones on both ends and a little bit in the anterior ribs, which also helps shoulders, breathing, and when your posture, slouches forward, the shoulders tend to round forward, right? Yeah. These moves help to release that and bring your shoulders more square onto your body. So take your arms out like this. Look at me. Bring them out like a T. Keep them there. Stay relaxed. Good. 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 What'd you say you saw some moves from somebody in Malaysia? They were doing a modified pull or something like that?
I seen a couple of things in Malaysia.
And you were thinking about going to Malaysia?
Gorilla hug or something.
A gorilla hug. Well, What do you think? You think you have to still go to Malaysia based on how you feel?
I don't think so.
I hope not.
No.
Got to be careful in Malaysia, man.
They like slap you around while they're
Yeah, they beat you up over there, and it's legal. They don't go to jail for it. Good. Nice. All right, rest your hands wherever you're good with the hands. Slide up a little more towards your head because you're tall. All right, now we're going to release. We're going to do a little pull here at the foot and the ankle. Should release the ankle, maybe the arch, maybe the knee, maybe more the hip. Just keep your leg loose and floppy. That's all you got to worry about. I'll do the rest. Relax. Let it go. Nice. You okay getting your toes popped?
yeah.
Got a couple. Let's pull this one. Relax. Nice. Boom. 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 Good. All right. Now we're going to do the shoulder ball and socket. The glenohumeral joint. Stay relaxed. Good. Just a little impulse in there. Make sure it's not jammed up. Unjam it if it is. Relax. Good. Okay. Pretty much that's all I do for this table. So when you feel ready, sit up and stand up and notice how your body feels getting up. Because transitioning, especially from down to up, is not easy for people with back issues. You know what I'm saying? So see if it feels easier. Let us know.
Oh, that's definitely better. I
Yeah.
definitely pop up way quicker.
That's a good sign.
Usually it takes me. I gotta
Grunt and shift and get the right position. Whoo! Look at that, man. Don't go too crazy the next couple days though. Let it heal and stabilize.
Okay.
We're gonna finish. Let me shut this off. Come back on this stool. Sit here. Just part of my full body. We're gonna do a little release in the elbow joints, the wrists, and the fingers. Then I'm gonna measure this forward head posture. See how that's doing, and then we're gonna talk about like what to do when you go home, pre and post. Drop it in my hands. What to do and what not to do. Drop it to the floor. Drop it. Yeah, loose. Nothing too crazy at the elbow. Good. Relax. And good. How to tell, if you should come back, all that kind of stuff. We'll talk about that in a second. Good. Rotate towards me. Give me the other elbow. Good. Drop it to the floor. Heavy. Good. Floppy wrist. Good. There we go. Got a popper for the camera. Good. Those people out there like to hear the pops, the crack addicts.
Yeah.
Done. Now, sit normal. Don't try to sit military, but don't slouch. Sit kind of normal. Right? Feels it?
Yeah, it's really good.
Boom. I wasn't hardly even touching your ear. So about 1.5 inches now. It was 2 1/4, 2 1/2. So came back almost an inch. Well, let's celebrate. That's pretty incredible for one visit. I know this wasn't your chief complaint, but that tells me we took a lot of tension away from this area, and your head's popping back over your shoulders. Yeah. But in a way, in a sort of indirect way, that does help your lower back, because when the head comes forward, it puts a lot of stress, and it destabilizes the whole back. It's a major imbalance. So when the head's back square over the body, everything else is stronger and more stable. So in the long run, that'll help. All right. Well, you told me the back was like a 1 or 2 pain when you walked in. What number would you give it now?
It's like at a 0.5.
0.5?
I feel
so it's a little bit, but like minimal.
It's not minimal because the stiffness comes with the moving.
Yeah.
But I always felt the stiffness.
Yeah.
I don't feel it sitting like this.
And normally you would. Is that what you're trying to say?
Yeah.
Good.
Yeah.
All right, good sign. Yeah. So now, truthfully, you had a good. My impression is it was a great release. Yeah. You're feeling better, but the real, test is go home, do your life for a week or so, and see how your body operates in life compared to how it used to, right? take it a little easy for a couple days if at all possible, because you don't really heal today. You get released today. Your body heals after the release. So for the next 2 to 4 days, if you don't mess with it, your body's going to be wanting to do some healing or repairing. And if you let it do it, you'll get optimal results.
So no working out.
I would take at least a day or two off of the gym to let it chill and heal. Okay. Definitely don't do any back stuff for the next couple days. If you get sore, a lot of people get sore from the initial release. We think it's because when we're releasing, we're opening up, we're releasing some scar tissue that might be adhesions in there, and you get like, it feels like a nasty after work, like a real bad after workout soreness. Mm-hmm. If that happens, know that it's kind of normal. Don't think anything's wrong. It's kind of normal. Doesn't happen to everybody, but it happens to a lot of people. And ice will be helpful to move it through. But you're an athlete, you've been working out, so you've probably felt like that before. Mm-hmm. Time also, but ice will help move it through quicker. And then wait 3 or 4 days to let it heal before you make a final assessment, because it could even get better as it does some more healing. It could even feel better. Make your assessment after 3 or 4 days. If you feel like, I feel great, I don't feel like there's any problems anymore, right? Feels normal, perfect. It could happen. Then there's really not a huge necessity or justification to come back right away for a follow-up. You don't really have to. Some people choose to anyway, kind of like one more, like an insurance treatment, but you don't have to. But if it feels partially better, but you're like, damn, this made difference better than anything else I've ever tried, but it still feels like it's not 100%, that definitely justifies maybe coming back in a week or 2 for a follow-up if you can get back your time and energy and money and all that. If you can get there within a week, it would be ideal. If you can't, 2 weeks, you'll still get it done. Maybe a little backslide, maybe a little slower progress, but it won't kill the process. Right. And then I just keep doing that scenario with my patients until they feel happy with and satisfied with how they feel, or they hit a brick wall. Sometimes you hit a plateau, and then we got to figure something. That's kind of how I manage my patients through, care.
Appreciate that.
Yeah.
I think that's what happens.
Visit by visit. I don't project out 1 million visits ahead of time like some physical therapists and other chiropractors do. Mm-hmm. Yeah. I don't believe that that's the right way to do it, because I can't predict the future. I don't know what you need. That's the God's honest truth. Visit by visit based on how you're doing in that moment. Then we make new decisions. Definitely. Yeah. That's the better way to do it.
I definitely feel like I have plateaued with physical therapy.
Yeah.
And I think this was definitely like the next step that was absolutely needed to get going again. It feels a lot better.
Good. A lot better. All right, bro. I appreciate you trusting me and taking the ride up. Yes. And I'm glad you had good results. Yes. Take it easy for a few days. You're welcome. Appreciate that. And if you need anything, holler at Zach and we'll help you out. We'll get your book back up again if you need to, or if you have any questions.
No questions.
No, I mean, moving forward, though, over the next week or a couple days ago, just text him. And if you need more, come back, we'll do more.
Definitely.
All right, let's say bye to the audience out there. Big Tommy, I think he's doing a lot better.
I think so, too.
I'm hoping. Yes. Hey, text him and let him know if you're doing good in a week or two, too. Even if you don't plan on coming back, let us know. If you're watching this and you're like, that looks like something that maybe would help me. I'm suffering. Nobody else is helping me. And you're willing to come to Central New Jersey, I would be honored to help you. Reach out. Best way to do that is go to my website, guruchiropractor.com. It's probably on the screen. And there's a book now button. Is that what you did? Yeah. You click that. It asks you to put your name, your cell phone, your email. Boom, hit send. It goes right to Zach. He gets a notification. He grabs your info and he texts you back. And you guys work out questions and all that kind of stuff. He gives you all the information you would need to know or want to know. And then if it works out, he'll help you book a good appointment and give you directions and get you here. If you get here, I promise you from my heart, God be my witness, I will do my very best to help you like I did with this guy.
Yes, sir. Make that trip.
Yeah, baby.
It's worth it. Absolutely.
All right. I don't help everybody, but we help a lot of people, and my heart's in the right place. And this is a calling for me, not just a job. So if you come, I promise you. All right. I'm going to say goodbye. This guy's doing better. Peace out, love. Next time.